then when we're in the elevator, we were in the basement. They told us to go back upstairs because it wasn't safe. However, they're yelling for us, diagnosed patients downstairs.
Right now at 11, frantic calls for help in Wilmington after bullets fly in a hospital this afternoon. Workers and patients forced out, hands up, searching for safety. New tonight, NBC10 confirmed that hours later, the gunman was captured roughly 30 miles away in Philadelphia.
The big question tonight, how does someone get a weapon that far into a place meant to heal? We are hearing from a security expert on that and digging into the reality of workplace shootings. Here's what we know. Late tonight, investigators say the shooting was targeted and isolated. Thank you for joining us. I'm Fred Shropshire.
And I'm Jacqueline London. 2 people were shot inside Christianicare's Wilmington Hospital. One of them is still being cared for, and the other died of their injuries. New tonight, we have learned the gunman has been captured. You first saw that breaking update on the NBC10 24/7 streaming channel and on the NBC10 app, where we were the first to push that alert.
And we have team coverage for you tonight. There was confusion and concern for hospital employees. Matt DeLucia is digging into the alert system and why some people were left in the dark. Shire Arias speaks with a security expert about how dangerous a workplace can be and how to prevent a deadly encounter. But first, we start with Johnny Archer. Johnny, we learned late tonight the shooter was taken into custody.
Yeah, that's right. They found him in Philadelphia, Fred. But here at the hospital is open and fully operational. Earlier today, this whole area was filled with police cars. But late tonight, as you said, police found that suspected shooter in Philadelphia, who they say is a 23-year-old man. They say this was a targeted and isolated situation where one person was shot and killed and another person was shot and injured.
Attention all units to Wilmington Hospital, 501 West 14th Street for a hostile MCI.
An emergency radio call for an active shooter inside Christianicare Wilmington Hospital.
All right, we're being advised now, 1 shot in the neck, 1 in the upper body.
Wilmington police say 2 people were shot inside the hospital Tuesday afternoon. They say 1 victim was killed and the suspect was able to escape from the scene.
Our investigators will be working tirelessly to apprehend the suspect and ensure they are brought to justice.
The hospital put on lockdown for hours as first responders from local, state, and federal agencies flooded the area. Eventually, patients and employees were able to leave.
I no sooner got out of the doors and all these police came rushing up.
It's particularly distressing when an incident like this occurs in a hospital whose fundamental purpose is to treat injuries and save lives.
Wilmington Mayor John Carney alongside Delaware Governor Matt Meyer sending their condolences to the victims and their families.
Every Delawarean deserves to feel safe, whether at home, at school, at work, or seeking care at a hospital. Today is a sobering reminder that no one is immune from the devastation of gun violence.
And police have not released any additional information about the victims or the relation to the shooter. As for the suspected shooter, charges, those are still pending, as well as the extradition back to Delaware. That is still pending as well because his identity has not been released yet. We're live in Wilmington. Johnny Archer, NBC10 News.
Johnny, thank you. And let's take a closer look at the hospital. Wilmington Hospital is one of the region's major medical centers and a key hub for Christianicare. The facility has 321 beds, spans more than 622,000 square feet, serving as the health system's corporate headquarters right in the heart of the city. The hospital features a level 3 trauma emergency department providing critical care as part of Delaware's trauma systems. Patients can also access rehabilitation, joint replacement, and outpatient services, along with diagnostic imaging and laboratory care, all in one location. NBC10 reporter Shire Arias also rushed to Wilmington Hospital. She spoke with a security expert on violence in hospitals. But Shire, you also got a firsthand account of the gunfire and scramble to escape.
Jackie, that's right. We did speak to one of the employees. He was inside the hospital when all of this was happening. Now, even though that lockdown has been lifted, I just want to show you that outside right here, we've also seen police officers still in the area, but also we're seeing some yellow tape right outside of the hospital. We spoke to that expert about what happened today. Let's listen.
Just craziness, just absolute craziness. Because like I told her, this is supposed to be a place for people to be safe, you know, and I don't have the answers. I'm not a politician, but somebody needs to figure something out. This is a problem in America. You don't hear about this everywhere else.
Brian says he was in the ER when the sound cut through the room, 2 bangs coming from floors below.
Just firecrackers almost, like just intense. Like it sounded like a 4th of July in there almost.
Only it was far from a celebration. From above, Skyforce 10 capturing the aftermath. Patients, visitors, and employees quickly filling out of the hospital, escorted by police. Tonight, questions remain, including whether the gunman had any ties to the hospital.
Once someone gets past a certain security level, they're going to be able to access other parts of the hospital. So typically, if it is an employee that belongs there, they could just bring the weapon in. Most hospitals do not screen everybody coming in.
NBC 10 spoke with a national expert on workplace violence in healthcare, who says hospitals see the front lines of injuries every day, but gunfire inside these walls is not common and deeply shattering.
This is a situation where, if you want to prevent something like this, that's part of the workplace violence prevention training, but you also need to know how to mitigate this. And these events do happen from time to time. They're very tragic, and it's very important that hospital employees are trained how to communicate in emergencies so they can protect themselves.
Now, even though, again, we are seeing that yellow tape here outside of the hospital is fully functional. The motive of the shooting is still, of course, under investigation. In Wilmington, Shaira Arias, NBC 10 News.
New data shows large hospitals in urban areas face a higher risk of violence. While Wilmington is considered urban, the facility itself is mid-sized. Let's take a closer look at inside hospitals. A study in the JAMA network finds on average there have been about 25 hospital shootings a year across the country from 2000 to 2024. And here's what really stands out from the study. Nearly 1/3 of those incidents might have been prevented with better weapon screening in place. And new tonight, an employee at Christiana tells us there are metal detectors at the hospital, but not at the employee entrance. A badge is needed to get through the employee entrance. However, it's unclear how the suspected shooter got inside the facility, and we do not know if he worked there. Matt?
Yeah, Fred, here in the Live Center, some employees said that they received an alert like this one here saying that there was a shooter in the building and that 2 persons were struck by gunfire. But others told us they didn't get any kind of alert on their phones until about an hour later. And the hospital's website also did not have an alert until roughly that time. Now, that alert says that the situation has since been resolved. But the NBC 10 investigators also looked at the federal alert system, which shows that no alert was sent out to anyone in the area. So this is called the Integrated Public Alert and Warning System, or IPAWS. So we reached out to the agencies that are responsible for sending those alerts. One got back to us. The Delaware Emergency Management Agency confirmed that no alert was sent today and referred us back to Wilmington Police. Fred, back over to you.